But there are other ways that you can be present in the lives of your loved ones without actually visiting the nursing home. You can call. You can send cards or letters. You can video chat. And you can check in with the nursing home staff in case your loved one can't regularly communicate with you. So it's very important to stay in touch. And I know personally how challenging it is not to visit your loved one. But we must make sure that they are protected and that they stay safe. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. Try not to touch your face, especially after touching surfaces, and clean surfaces frequently. Practicing these everyday prevention measures can help slow the spread of the virus COVID-19. If you have questions about your health, please contact your healthcare provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is please stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. From WNEP, there's people who have been infected and then get better. What are they doing to get better other than, hospital care if they don't need a hospital? Is there medication? Is there medicine? What are they taking to get healthy?
So, as we've been discussing, this is a novel or new coronavirus. So no one has immunity to this virus. There is no accepted standard of care medication for this virus, and there is no vaccine. And so people who are mildly ill would needs to stay home and to rest, drink plenty of fluids, and take acetaminophen for fever. And that is the best way to get better. Basically, your body will develop an immune response, and you will overcome the virus, and you will recover. But it's very important for people to monitor their symptoms at home very, very carefully. And if they start to have worse symptoms, very high spiking fevers, if they start to have severe shortness of breath, chest pain, labored breathing, we do not want people to wait too long. Please call your healthcare provider to discuss your symptoms and if you need to be evaluated. And if there's an emergency, please call 911 to access emergency medical services.
Secretary, we have two questions on nursing homes from WNEP and Bucks County Courier-Times. First, about mandatory testing for employees at nursing homes. Is this required? And then, how many nursing homes in Southeast Pennsylvania have coronavirus and what counties are affected?
So, employees in nursing homes are certainly required to stay home if they are sick. If they have a fever or respiratory symptoms, they should stay home and follow the same guidelines that we have been discussing. If they come to work and they're having symptoms or if they have a fever, they will not be admitted into the nursing home. And then the nursing home will ask them to get evaluated and tested. We're not testing asymptomatic people at this time. We're not testing people who have no symptoms, no fever, no respiratory symptoms, no cough, no shortness of breath, because a negative test really at this time doesn't mean that much. You could be, if you haven't been exposed, you could be exposed the next day and then test positive a few days later, or you could be in that incubation period where your test would be negative even though you're just starting to have the virus. So unless you're doing very large population-based testing, which we are not at this time, then we're not testing asymptomatic people. I don't have specific data at my fingertips for the Southeast. What I can tell you is that there are 64 confirmed nursing home cases in Pennsylvania. That represents less than 0.1% of the nursing home population. Again, less than 0.1% of the nursing home population. There are 36 facilities which have at least one positive case, which represents 5% of the total of 695 nursing homes in Pennsylvania. The majority of those nursing homes are in the southeast, but I don't have county-specific information at my fingertips at this time.
Secretary, we're getting some questions about the stay-at-home order. First, why are we doing it on a county-by-county basis? And then Penn Live would like to know, can we expect Dauphin and Cumberland counties to be under the stay-at-home order since Centre County has fewer cases and was included?
So we are taking a very measured and sequential approach under the governor's leadership to the stay-at-home orders. And so this has rolled out on a day-by-day basis over the last week. And so we're evaluating many different factors. We're evaluating the number of cases, quote unquote, per capita or per 1,000 individuals in the county. We're also discussing these issues with county commissioners and other county officials, such as our county municipal health department partners, because they're right there in the county and know the situation on the ground. So that there are a number of different factors. And so that is the basis behind this sort of measured sequential approach to the stay-at-home orders. It's hard for me to tell you what's going to happen tomorrow, but we discuss this every day with the governor's office and the governor and make decisions on a day-by-day basis.
From WJAC, if someone has been exposed to a person who is confirmed to have coronavirus and then they themselves begin experiencing symptoms, is it recommended that hospitals test them even if the symptoms are mild, or would that require more serious symptoms before it would be recommended that they get tested?
Sure. So if you have been exposed to someone with COVID-19, that would mean that you should be quarantined. You should be staying at home for at least 14 days to see if you develop symptoms. If you develop symptoms, again, as I was saying before, it depends upon the seriousness of your symptoms. If you have a very low-grade fever, if you have a cough, but otherwise you're feeling well, then it isn't necessary. You can always call your healthcare provider, but it is not necessary to go to an emergency department because, again, there's no treatment, and so you should stay home and rest and drink fluids, take acetaminophen for fever, and recover. If, however, you start to develop worse symptoms, please don't wait too long. If you're developing high spiking fevers, if you're developing a more serious cough, shortness of breath, labored breathing in any way, then please either contact your healthcare provider to discuss that, or if the symptoms are an emergency, go to the emergency department. And there, of course, you will be tested.
Secretary, from Penn Live, we've seen images of the Javits Center in New York being converted into a field hospital. Is Pennsylvania making plans to create field hospitals if they are needed? And if so, what facilities are you considering as sites?
So there are 2 field hospitals that are being set up in the southeast. They're not ready yet, but we have received materials from the federal government to set up these type of field hospitals to be able to deal with a potential surge. And of course, the area that has the most population that would be most at risk from the surge is southeastern Pennsylvania, more population dense. And we are looking at many other types of facilities to deal with the whole continuum of care. As I've been describing, it's involving the number of ICU beds that we have. It also involves the number of infection control beds, what are called medical surgical beds, traditional medical beds, and then working to be able to deal with less severe subacute patients as they convalesce. And that might be, for instance, even hotels. So we are working with our community and municipal health department partners on all of those plans.
From the Record Herald, the data we are being provided indicates the majority, about 41% of cases, is in residents 25 to 49 years old. Is there any data to indicate why this age group seems to be leading the number of cases?
This highlights one of the things that we have been saying for a long time now, is that younger adults and middle-aged adults should not be complacent. They are not invulnerable, and they are susceptible to this virus as everybody else is. And so they can get very sick too. And a significant number of those have required, of people in that age group, have required hospitalization. The death rates are lower in that age group than in seniors over 65, because seniors have more other medical problems such as heart disease, lung disease, and kidney disease, which weakens their system so that they are more likely to have serious complications and tragically might pass away. So this is not a complete surprise to us. Other countries have seen this young adult and middle-aged age group have significant number of cases. And so people need to listen to the governor's orders about mitigation or prevention in terms of the school closures, of course, the non-essential business closures, and the stay-at-home orders. And that includes young adults and middle-aged adults.
Secretary, from PBS 39, St. Luke's Health Network in the Lehigh Valley has just declared the Poconos a hot zone for COVID-19 because of its proximity and ties to New York City. Are there any plans to expand public testing sites into the Poconos or Lehigh Valley? And has the state identified the locations for any more specific testing sites?
So at the moment, we have the two mass testing sites, and they are located in Philadelphia and in Montgomery County, and they've been actually going now for almost 2 weeks. Those are funded by the federal government and the Federal Department of Health and Human Services. So we can discuss with the federal government the possibility of setting up other federally subsidized mass testing sites, but the decision will be theirs. But we certainly will be working with the hospitals and health systems in the Pocono area about having testing sites and being able to handle the increased number of cases in that area.
Secretary, from WKOK and Middletown Press and Journal, some questions about rural Pennsylvania. Are enough tests being done across the state, especially in rural areas, to give us a true picture of coronavirus in Pennsylvania?
Well, so we encourage people with significant symptoms, to, as I've been saying, to seek out health care evaluation, and then those individuals would be tested. It isn't surprising that we would see less cases in rural Pennsylvania because we have much less population density. But rural Pennsylvanians, of course, have challenges in terms of the accessibility of health care. That actually forms the basis for the Rural Health Initiative that the Department of Health has been working on for a number of years now. And so I think that the statistics are accurate. We know that we have an undercount of it really in Pennsylvania and throughout the nation in terms of the number of patients, and that some patients with either very mild symptoms, are probably staying home, as we talked about. We don't know those test results, but we can presume at this time that if you have symptoms consistent with COVID-19, that's what you have. So I think our counts, as we look across the state, reflect the situation that we're seeing in Pennsylvania.
And then as a follow-up, if local hospitals become overwhelmed with critically ill patients, why not transfer those patients to other hospitals which aren't full and still have critical care beds?
Well, we'll be considering any options. So what we're working on, of course, is to try to prevent a large surge of patients that could potentially overwhelm our healthcare system. And so that is the purpose behind the prevention and mitigation efforts of the governor, including the stay-at-home orders that we have been discussing. So that would turn a large tidal wave of patients into a small wave of patients that we can deal with. But we will consider any possibility and any contingency plan if certain areas are at risk of being overwhelmed, including transfer. We have to deal with the issues in terms of the logistics of transferring patients, which can be challenging, but we will consider any contingency plan if that is needed.
From the Express Times, anecdotal reports indicate that it is taking up to 10 days for Pennsylvanians to get back COVID-19 test results. Does this mean that current positive results are really a snapshot of a spread a week ago? What is the state doing to speed up testing turnaround times? And will rapid tests be put into use?
So Our testing results that are done at our state laboratory for priority patients, such as healthcare workers, nursing home patients, etc., we can have those results within 24 hours. For a number of hospitals and health systems, they could have a more rapid turnover of results if the tests are being done at their own laboratory. But we have heard that the commercial laboratories have waiting periods. I haven't heard 10 days, but certainly up to 5 or more days. So that's a significant issue. We have been in contact with Quest and with LabCorp about that, and we'll do everything we can to try to decrease the waiting time to get results. Our results that we get, that we report every day, are always a snapshot. They're always a snapshot in time at 12 midnight of where the states and local areas stand at that time. And they are dependent upon which labs are coming back from different laboratories. So trends are more important than exact numbers, and we have been emphasizing that. We're looking at trends over time in terms of the rise of cases. And so it's always a snapshot, but we realize that and we figure that into our thinking.
From the Inquirer and PA Post, questions about ventilators. Updates on the state supply of ventilators. How have efforts been proceeding to acquire more? And do you anticipate filling the gap before the surge in cases hits?
Mm-hmm. So we have more than 4,000 ventilators that are actually within healthcare systems. We also have store ventilators at the Department of Health to deal with any surge. And actually, under the governor's leadership, the Department of Community and Economic Development has been looking to purchase ventilators. And we actually have indeed purchased ventilators that we'll be getting over the course of this month. So we are preparing for that potential surge. The key to the integrity of our healthcare system is going to be to limit the size of that surge. And that is why the early implementation of the stay-at-home order and then the business order and now the stay-at-home orders in the different counties, the school closures, is critical to Pennsylvania's response. But we are working to have ventilators for any patient who needs it, but we have to cut off the top of that surge to be successful.
From the public source, the state has seen a 28% or greater rise in the number of cases for 13 days in a row, increasing at a rate of about a third per day. How long will it be before we can tell whether social distancing is working? And if it's working, excuse me, when will we expect to see the start of it, to see that in the data?
Mm-hmm. So it takes weeks for social distancing to work, especially in regards to the delay that we've been discussing in getting some laboratories and those results back. So we are going to be watching the data every day for first a plateauing of the number of new cases that we're seeing, and then a decrease. But then, as I've been saying, it's the change over time which is important, and we need to see a sustained plateau and then decrease in the number of new cases, and that will show us that our efforts are proceeding. It's critical at that time not to release the mitigation efforts too soon, or we'll just see another peak. So we'll be watching all that very carefully under the governor's leadership.
From the Associated Press and WLVR, questions about when the peak will happen and when our modeling suggests that it will happen in Pennsylvania.
So we're looking at a number of different models. And as I said yesterday, the Department of Health is not doing its own modeling. We actually had collaboration with the University of Pittsburgh School of Public Health on their model. They actually released aspects of their model in the paper a number of days ago. But we also have been looking carefully at Penn's model, as well as the University of Washington's model, as well as some other national models that would include Pennsylvania. So we're processing all of that data in terms of our thinking about when the surge will occur. We don't know exactly when the increase or surge will occur. As Dr. Fauci has said, is that the virus determines the timeline. We don't determine the timeline, but we're watching the data very carefully for an increase that could indicate a surge, and then we will take preparations to make sure that our healthcare system stays intact.
Secretary, from PBS 39, you've told us a little bit about your mother at the start today. Thanks for giving these briefings every day and through the weekends. We're wondering, how are you doing?
Well, that's very kind of you. I am doing well. I am trying to the best I can to take care of myself and and eat regularly and get enough sleep. I'm just obviously very concerned about this global pandemic in Pennsylvania. But I am well and here every day to work with the governor and the governor's office on our vision of a healthy Pennsylvania for all and getting through this global pandemic of COVID-19. But thanks for the question.
From News Talk 104.1, on testing, has the supply of tests increased to meet the increased demand, or are more tests needed?
Well, for our current method of testing, this week we have enough testing to meet our demand. So we have testing, as I said, available through our state laboratory. We have testing through hospitals and health systems, either through their laboratories or more and more common through the commercial laboratories. And then we have the 2 mass testing sites in the southeast. And so right now, in terms of our case-based testing, we have adequate numbers. And we're getting better supplied by the federal government and by testing companies such as Roche, et cetera, so that we have enough reagents and chemicals to do the test. A week or so ago, that was a challenge getting those, as I had outlined, but we're good right now. If we were going to move to a different type of testing, as had been done at the very beginning in Singapore and in Hong Kong, which involves much more mass population testing, we do not have those supplies. No state has those supplies at this time. But that might be something that we'll be looking at later on in the year as we've gotten through this episode of COVID-19 and we're looking towards the future.
From the Morning Call, what are the proper protocols businesses must follow if someone inside a business tests positive or even is suspected of being positive for coronavirus?
So we have testing protocols for businesses on our website at health.pa.gov, and we're actually looking to flesh out that with even more guidance at the beginning of this week.
Specifically, as a follow-up to that question, many workers are worried about going to their jobs and that social distancing isn't happening at their facility. They're worried about potentially losing their jobs if they don't report. What is or can the state do to reassure everyone about this? And why does it seem that warehouse facilities are being exempted from having to do social distancing?
Well, so warehouses are not exempt from doing social distancing, and those type of prevention efforts, such as being 6 feet apart from people, such as hand washing, etc., are critical. The critical life-sustaining businesses are open, and so warehouses are part of that. Warehouses that have food or other essential items are incredibly necessary, but they should be following those general business social distancing messages, such as frequent hand washing, hand sanitizer, and keeping 6 feet apart. And so we're going to work to make sure that that message gets out to businesses, and we have some new guidance for businesses coming out with even more details this week.
We have several questions about the correctional facility system. First, from PA Post, about releasing basic details of people who test positive for the virus online. Will you release more information on where inmates test positive so that families can be aware of these issues?
So we are coordinating with the Pennsylvania Department of Corrections and Secretary Wetzel. At this time, actually, the Department of Corrections has information on their website, and if and when there are positives in their facilities, they will put that on their website. And then we're coordinating whether we're going to have that information on our website or just on theirs, so we're kind of working out those details. It is important to remember that that is for our state Department of Corrections, and of course there are county correctional facilities which work with their county municipal health departments and their county commissioners in terms of that data.
And then as a follow-up to that from PLS Reporter, questions about SCIs in county jails and whether or not they have tests on hand for their inmates and staff.
They do have tests on hand for inmates and staff, and then, of course, they'll be sending them out for the laboratory analysis, but they do have the ability to obtain a specimen.
And then just to recap for us, I am still getting several questions about the number of critical care beds that we have in Pennsylvania. Could you go over those statistics one more time, please?
Sure. So currently we have 3,400 intensive care beds in Pennsylvania. Approximately 40% of our ICU beds are still available, although this number fluctuates on a day-to-day basis. So our healthcare system has capacity at this time to deal with patients with COVID-19, but we're watching that data on our internal dashboard every day.
And then our last question is from News Talk 104.1. With all the new positives, is it encouraging to see the number of those in hospital stay the same for each day, so that our hospital figures percentages aren't rising? Is that encouraging to you?
I think that's encouraging, although 10% is what we expected. And so if it was rising consistently more than 10%, that would, of course, be concerning. So using that 10% figure gives us an estimate in terms of how we analyze modeling about our capacity to deal with a potential surge. So we're watching all of this data. We have our own internal dashboards where we're looking at this, and we're watching those trends over time to deal with any contingency plan that develops.
Thank you so much, Secretary. That concludes our briefing for today. For reporters whose questions we were not able to get to, we will follow up with you today from the Department of Health or the Governor's Press Office. Please stay tuned for our next briefing tomorrow.
Thank you.